Welcome to today's episode of the AI Trailblazer podcast. Today we have a very exciting guest. He is none other than Aditya, the co-founder at DocGenie. So without further ado, Aditya, it's a great pleasure to have you here today. Let's start off with yourself and what led you to start DocGenie.
So first of all, thanks for having me, Bruce, on the podcast. It's great to be here. So basically, I had an interesting journey leading up to launching and starting DocGenie. I grew up in Delhi, in India, and I did my schooling there. And interestingly, for most of my school time, I wasn't really into entrepreneurship. I was kind of just more focused on doing a regular job at that point. My first foray into entrepreneurship came when I went to the University of Pennsylvania for my bachelor's program in economics. There, I ended up doing a 9 month entrepreneurship boot camp where I got a lot of exposure to founders, to entrepreneurs, to builders, and generally the startup ecosystem. And to me, it was quite inspiring to see people from so many different backgrounds, so many different walks of life solving a lot of different problems, right? And I found it quite inspirational. And that kind of set me on the path towards launching my own thing. So when I was done with the program in 2017, I spent about 6 months just ideating and focusing on building kind of a prototype for the healthcare product, for the healthcare sector in general. And the reason I picked healthcare was that a lot of I grew up in a family, in a community of healthcare providers, doctors, and I saw firsthand a lot of the issues that they faced, especially in terms of the operational workloads, the inefficiencies with the different tools that they use, and how it's not really interoperable. And fundamentally, the trend in healthcare was that a lot of the digital revolution focused on the patient side. So you got a lot of telemedicine platforms which make it very easy for patients to consult with doctors, but they don't really focus on easing the doctor pain points, right? So that includes interoperability, includes certifications, regulations, all sorts of things. And so we felt that this is a really untapped market that we should look into. And that led us to create this telemedicine solution, which primarily focuses on a doctor's needs, right? So it solves like an end-to-end solution for doctors in terms of virtual care capabilities. And then obviously the patients benefit as a result of this indirectly. It was, I would say, about an 18-month journey from ideation to eventually launching the platform. We did a soft launch, we onboarded a few doctors, tested it out, got some feedback, and then eventually went to market all across India.
It's great. So right now, how big are these companies that you work with? And then can you share a more specific example of what problem is it trying to solve when it comes to telemedicine?
So I'll answer the second question first because I think that leads into the first question you asked. So the problem we're solving very simply is that in this day and age, even in 2025, you have about 50% of all primary healthcare units around the world who do not have a robust telemedicine solution, right? That translates to about 460,000 separate units. The reasons for this is it's extremely expensive to build an in-house telemedicine solution, especially if you're a mid or small-sized clinic or healthcare provider. This is usually organizations with less than 200 people. So it's extremely resource and time-intensive effort. The second issue is that right now, in a lot of cases, like doctors and healthcare providers, they use 4 or 5 different platforms for different functions, right? So they have one tool for EMRs, one tool for payment, so they use Stripe maybe for payment or PayU, etc. They use Zoom or Google Meet for video consultation. They use another tool, an appointment scheduling tool to schedule and set reminders, etc. And none of these are interoperable, right? They're all kind of disconnected. So the amount of time and effort it takes for them to kind of upload the patient documents on one end, but then also send the prescription to the patient from the other platform is extremely time time. It puts the patient data at risk in terms of confidentiality, in terms of security, etc. Right? So this is extremely inefficient as a setup, and that's why these two trends led us to kind of focus on small mid-sized clinics which offer multi-specialty consultations, usually OPD, so outpatient care, not emergency care, obviously, because telemedicine is not built for that, but clinics which offer multiple specialty consultations and usually have less than 200, 250 employees. So that's our target ICP. And the way we approach them is obviously these are our direct consumers, but there are also other players in the ecosystem, right? So you have healthcare vendors, you have resellers, you have third-party administrators who these hospitals and clinics work with. And they oftentimes are the decision makers when it comes to deciding what tool stack, what technologies the hospital should be using. So we kind of approach either through the vendor side or directly to the providers. And those are typically our customers, I would say. And we have right now about 15 different B2B partnerships spanning vendors, direct healthcare providers, multi-specialty clinics, as well as more on the NGO side as well, which work with governments.
Okay. Then when you talk about vendors and healthcare providers, what's the big difference? Like what? Can you share some more specific examples as to who are the vendors
Yeah.
specifically?
So vendors in this case would typically be the technology providers for a hospital. So those the companies which provide enterprise solutions for their clinical management systems, for example, or they house the databases for clinics, etc., etc. So more on the technology infrastructure side, or they are usually insurance providers or administrative service providers who help clinics and hospitals manage their day-to-day workflows, etc. They work on contracts and they have multiple different clinics that they have on their service portfolio. And then they are usually looking to add telemedicine as a solution as well for the clinics. So the way you approach that is slightly different in terms of the messaging. You focus more on kind of the ROI for the vendors themselves in terms of how much workload they can save by integrating this platform and then reducing their workload for each client, and as a result, the number of hours reduced, etc. In terms of the healthcare providers, it's direct to them. So you have to identify the stakeholders within a hospital or within a clinic. And this could be a medical director, this could be an operations head, this could be a finance head. And usually the pitch here is that it reduces patient no-shows a lot because the bulk of the primary care chronic care consultations is around follow-up appointments. And a lot of times, the biggest leakage in revenue for healthcare providers is that patients don't show up. Either they missed it, they forgot about it, or it's just too much of a hassle for them to visit the hospital or clinic for a regular follow-up appointment, right? So multiple studies have shown, for example, that a good telemedicine solution integrated into a clinic reduces patient no-shows by 40%. So that's a big revenue saver for a mid-sized clinic, for example. And then related to that, you have higher patient satisfaction because the experience is generally better. Patients prefer to do teleconsultations if they don't have to come in and visit a doctor. So all those are good sticking points that drive conversations with providers. So slightly different to what we would tell vendors.
Okay, that is very helpful in giving some more context as to why is this so valuable for telemed for healthcare providers and also for the technology vendors themselves. So could you share more about your role within the company and how it fits into the bigger picture at DocGenie?
Yeah, so I'm the co-founder and the business head. So I take care of all the operational and business side. This includes negotiations with partners for contracts, identifying new opportunities for growth, and essentially deciding on the tool stacks. If we're doing kind of B2B outreach through LinkedIn or email, for example, what are the best tools for us in terms of the databases they provide, the tools they offer, and also obviously more on the operational side, so internal operations, setting up, when we hire someone, the whole onboarding process and making sure they're up to speed, et cetera, et cetera. Not of the internal operation process, but also the growth side. And yeah, that's primarily been my case. Recently, over the last year or so, we've also been fundraising, right, to fuel our international expansion efforts. We're in the stage of closing a seed round, and a lot of the fundraising effort was also led by myself.
So you talked a bit about the fundraising aspect as well as how you manage the business development side of things. Could you share more? What is your goal for the company, let's say for the next 6 to 12 months?
So, very clearly, the key milestone or the key North Star that we have is so we have about 15 B2B customers. This comprises 350 doctors across 36 different specialties. The goal is really to build it up to 30 partners going live in the next 1 year, right? And so, building the scalable GTM process that helps identify the right profiles, the right targets, and then creating that momentum, right? Building case studies around successful partners who've had benefits from our platform, and then having those conversations, attending conferences, and getting more contacts, etc. So, yeah, the goal is really to try to hit 30 live partners. I would say by either mid next year or end of next year. So maybe 12 to 18 months. That's the key goal. And the fundraising that we're doing right now is going to help fuel those efforts. So obviously, the more clients you deal with and the more countries we expand into, there are going to be more product specifications, country specific aspects and features that we have to look into. So all of that would require product investments and enhancements. So that's also something that will be part of our plans.
Okay, makes sense. Then you've pointed out like a couple of channels that you use to outreach to potential partners, like email or LinkedIn. So, what would you say have been some of the channels that have been working well, or go-to-market strategies that have been working well, and then what are those that haven't been working as well as you expected?
Yeah, so I think Apollo that we use for B2B sales enrichment has been quite useful to identify, some of the key prospects and decision makers at our target ICP institutes. And I think it's because of the intent-based keyword searches and filtering that you can do. So it helps us really target the right profile. And then linked to that, we use Instantly to launch our campaigns. So we schedule and launch different campaigns. And obviously, the messaging is very different depending on who we target. So even within a healthcare provider organization, we have a different messaging for the operations head, for the finance head, for the doctor, the medical director example, right? And then obviously the vendor side has a different messaging and uh, value proposition altogether. So I think that has been working well. What has not been working as well, and is something that we need to look into, is the LinkedIn side of it. So using Sales Nav and identifying target audiences, and this is more on the vendor side rather than the healthcare provider side, because doctors are generally less likely to be super active on LinkedIn anyway. So it's more on the third party provider side and all that. But it's about identifying the right profiles and sending the right messages, and I think that's something is a bit of a challenge for us, and so we have to dig deep into it and find out how best to do it.
Okay, interesting. So, what are the steps that you have been taking to overcome some of these constraints then, like, what you said regarding finding the right profile, the right messaging for this target profile?
Yeah. Honestly, it's more about understanding, because we have a good idea of the provider side because we've dealt with them for 5 years now. But the vendor side is something that we've started dealing with over the last year or so, right? When we realized there's a lot of other ecosystem players that we can go through. It's more about understanding exactly, what motivates them, what drives them, and like what could be a good pitch and selling point for them, right? So it's I think it's a trial and error thing where you test out multiple different messages, multiple different campaigns, and then see what works. So that's one challenge. The other challenge is honestly maybe finding the right medium to reach out to them. Maybe it could be through healthcare conferences rather than cold outreach through email or LinkedIn. That's something, I mean, I don't have a definitive answer to that yet, but it's something that is a possibility. So identifying the right channel to contact them, but also identifying what moves them, what would drive them to have an intro conversation with us is, I think, the two things we're working to improve on.
Got it. Okay, so as the co-founder and also the person heading the business development side of things, what kind of success matrix do you look for when you launch this kind of go-to-market channels that you want to look for?
Yeah, so we use the classic the sales funnel, the B2B sales funnel conversions just to measure the success of the campaign. So everything from click rate and reply rate to email campaigns, all the way down to, like the conversion from outreach to the first intro call. And how many kind of follow-up messages it took for them to like get to that point. So all these, kind of different metrics up to the sales call. And then from the sales call, we have a very simple onboarding process. We do the demo, we sign an NDA, and then we discuss the scope and tech implementation part of it if they want to proceed with it. Um, and then we launch a pilot program. So we offer pilot programs to all our partners for up to 60 days. And the idea is for them to get comfortable with the whole platform, the whole setup. And then if they are fine with it, then we switch them to a monthly or annual plan. Yeah, all across them, we do measure the conversions across the drop-off rate all across to see. And obviously, I think maybe it's true for a lot of cases, but the first step, getting them to the intro call part is always the most challenging one. And I think that's the one we're looking to optimize the most.
Okay, then how are you planning to optimize this part of the sales process, getting them to sign up for the first intro call?
Yeah, there are multiple. options we're looking into. One is, instead of sending out an email where the CTA is essentially, hey, book a call with us or book a call with me to do an intro call, learn more about the product, we can even send an email with a demo of the product in a, like a 1 minute video or something like that, or just alter the content of the email and then do some of that A/B testing, right, to see what works best, what appeals to which specific segment of our target market. That's something we're doing, and we've seen that, for example, the demo call version works better than just sending a text-based email and saying, hey, look, if you want to talk more, just here's a Calendly link and you can just book a 30-minute call. I think that doesn't work as well as them at least seeing the platform and the demo first, right? So that's one thing. The other thing is really more building our own brand awareness and credibility, right? And something we haven't done so far is really having B2B case studies, and that's something we're focusing on. So we're working with three or four partners right now to launch some case studies, which really in the B2B space do help drive a lot of conversations. Those case studies can also help be part of the emails that we send out, right? So those are some things that we're looking into.
Yeah, makes sense. It's very important, as you said, to have case studies to build the credibility and trust with any potential partners or vendors. Yeah, then let's talk a bit about the challenges. What sort of challenges are you facing in growing DocGenie right now? The biggest ones that are holding
Yeah.
you back from achieving your goals.
Yeah. So I think related to the previous points, I think it's about identifying the right decision makers in an organization. Because, a lot of times it's not super obvious who the decision makers are. Because, like you would look at, for example, an organization chart and say, okay, maybe the CEO or the COO is probably the main decision maker. But in a healthcare firm, usually that's not how it works because a telemedicine platform is used by doctors, so the chief medical director or the chief medical officer is sometimes the decision maker, or it could be the head of technology or head of product who's the decision maker. So sometimes you have to really you have to identify maybe three or four different stakeholders within each organization and then send out an email to them, and hopefully one of them is the key decision maker, right? So it's about, yeah, that the key challenge is obviously to find out who these are. And I think the more we kind of do these outreach, do these calls, the more we get a sense of it. But it's still not super obvious sometimes when we identify, okay, this organization is good for us, but who do we reach out to within this organization, right? So I think that challenge still remains, and it's one thing we have to solve.
Yeah, that makes sense. Then what kind of impact does this have like on your business if you are not able to, find the right decision makers early?
So
Like why is it so urgent to solve this?
yeah, so what we do is basically, even, and, this is where, our global network of 350 doctors really comes in handy because they usually, what we do is, and usually some of them help us with outreach as well, right? And then they have their networks and they tap into them and we make some intros and first introduction meetings, etc., etc. And those are quite powerful, right? Because a doctor recommending a platform to another doctor is the best sales tool in healthcare, right? So that is something we look into, and that's why, in some cases I do like to involve a couple of doctors who have invested in the platform, who have a stake in the success of the company as well. They help join the intro call and help pitch the platform to them as well. So just to improve the efficacy, and we've seen quite a big improvement as a result of that.
Okay, got it. That makes sense. So you've pointed out quite a couple of different outreach initiatives that you've embarked on, like, a LinkedIn, email, and then also this referral program with the doctors. So like what would be your biggest priority right now for DocGenie, let's say for the next 6 to 12 months?
Yeah, so within the next 6 months, so we have a few very interesting clients in the pipeline, and we've signed a couple of contracts with them. The goal is really to bring them on board, go live with them, and then make sure they have a great experience. So, for example, we're in discussions with the Ministry of Health in Ghana to launch a 2-year pilot program to help integrate our platform to their whole network of primary care clinics all over the country. Now that's a big project for us, and we want to make sure that we do everything right and make sure the experience is good, so that we have a strong in it builds a lot of credibility for the company as well. The second one is a company in a community in Texas where they have 35,000 nurses and caregivers, and they usually are the first point of contact for a lot of people in the United States, right? So before they reach out to a doctor, they go through a caregiver or a nurse. integrating our platform to this community so that they can facilitate these consultations. So in the next 6 months, like my immediate goal right now is to make sure these partnerships go smoothly, right? To make sure that the full implementation end to end is good, their whole experience is good, any kinks in the implementation or operational process ironed out, and then yeah, just build on this momentum that we have, and then like I said, by the end of next year, try to have 30 live partners.
Yeah, makes sense. So you've talked a bit about like in the integration side of things, making sure the onboarding is smooth. Then can we also chat a bit about like what kind of shifts are you seeing in the industry right now, and then how is that impacting the growth of DocGenie?
Yeah. So I think one consistent trend throughout healthcare has been the issue of interoperability, right? And the idea that it's not, for example, the more telemedicine platforms you have, and there's more proliferation of these different tools, it's not going to actually make life easy for doctors because they just have more platforms to deal with, right? And a lot of them are not going to be interconnected. They're going to be siloed. They have their own specific formats, etc. So it's just going to actually increase their workload. And so now more and more, especially with the USAID cuts as well, so a lot of like funding programs for healthcare have gone down. A lot of the focus has been on high efficiency uh, platform alternatives, which kind of solve all these issues in one basket, in one bucket. And I think this is across the board, not just in developing countries, but across the developed world as well. That essentially they're looking for efficiency gains and making sure to cut costs and leakage wherever possible. Have like this one-stop solution, and that works well for us because that was something we've been pushing for since when we launched in 2020. And that's why we feel I feel like we're in a good position to kind of capitalize on these trends of greater efficiency, more focus on interoperability, and more focus on identifying and correcting the pain points for doctors. They want something that actually concretely benefits their day-to-day workflow, but also benefits their patients.
It makes sense. So it's essentially about having all-in-one integration into one platform that they can
Exactly.
seamlessly use
Yeah.
to help both themselves and the patient as well. Okay, got it. Well, that's actually about it for the podcast interview. Once again, thank you for your time and for agreeing to jump on this podcast as a guest, Aditya. I think you've shared a lot of valuable insights about how DocGenie is revolutionizing the telemedicine industry and streamlining the different processes for the doctors and the patients as well. Thank you for your time.
Thank you so much, Bruce. Great to meet you.